coming into this as both a physician, a scientist, and a mom, there were very conflicting things that I needed to figure out to make this decision. And I was already pregnant at the time that the vaccine became available. And so I had been concerned about contracting COVID, clearly through my job or even through community spread. And it was a little bit of a sigh of relief to know that there was something available. I was originally a little upset that there were no pregnant women in their studies because I would have loved to have the data to help me make a decision. But it makes sense why those things were left out. So to be true to both aspects of who I am, because those are not mutually exclusive things, I had to look at both the scientific part that we knew and also me as a mom, what was important to me. So from a science standpoint, even though they're still collecting data on this, currently the thought is that pregnant women are at 5 times a higher risk to have a severe COVID infection. So even though I'm otherwise healthy and am in a younger category, so would not be at high risk of having a severe disease at baseline, increasing that by 5 times was certainly concerning to me. If you couple that with the fact that they feel like pregnant women are 4 times more likely to need a ventilator because they have reduced lung volume and lung capacity, particularly in 2nd and 3rd trimesters, especially if you've ever been pregnant, then you know that you lose the ability to breathe very easily as time goes on, and that increases that risk. They've also associated with preeclampsia, which has an association with seizures if you go on to eclampsia, also preterm labor, and other complications in labor, things like blood clots that pregnant women are already at risk for. So those weighed on my mind as risk factors that would affect me. And then I looked at what are the risks of the vaccine. So because they didn't include pregnant women in the studies, I couldn't pull any direct data. Also in the Pfizer study, when I watched the FDA hearings, which I did because I was curious about all of these things, even though they didn't want their patients to be pregnant and they asked their female patients to use birth control to prevent pregnancy, 23 people in their study were pregnant. About half of those were in the vaccine group. All of them are still pregnant. Moderna had about 13 people in their study who were pregnant, 6 of them in their vaccine group, all of which are still pregnant, with no complicating side effects. So I took that information and then I went to my obstetrician, who is a physician here, with that information and said, what should I do? And her suggestion to me was based on the ACOG, or American College of Gynecology, and the Society of Maternal-Fetal Medicine guidelines, which said we should not be left out of being offered the vaccine. So taking someone that I trusted as my physician, as someone who I trust to help me bring a child into the world, I respected her opinion on that. And then I had to think about this as a mom. If I were to get COVID and have a severe infection and end up ventilated, there is a possibility that I will never meet this child, or that this child may never meet me, and that my son at home no longer has a mom. And I can't bear the thought of that. I would do anything. I'd crawl over broken glass to prevent that from happening. And I have, my toddler can't be vaccinated. This baby will not be able to be vaccinated until those studies have been completed in younger children. So the potential to give antibodies safely to this unborn baby through transfer through the placenta, that hopefully by the time they no longer have passive immunity, everyone else has had an opportunity to be vaccinated, was also helpful. My husband cannot be vaccinated. My high-risk parents, who will likely come help when the baby is born, I'm their biggest risk. So if I were to get them sick, I lose my parents and also potential help. So when it came down to a very risky infection, which increases my chance of being severely ill, needing a ventilator, or even not making it out of the hospital, and potentially leaving my children without a mother or losing my own parents in the process, was a no-brainer. So my first vaccine I got at 21 weeks, and I had a sore arm. I purposefully chose my left arm because I'm right-handed, just to prevent any potential issues. The next morning, my arm was sore. So about 12 hours later, my arm was sore. I did a workout that morning with no issues. Because this is my second baby, I have definitely felt him moving more than I remember with my first pregnancy. And so I was able to kind of keep up with that. I knew what was normal, so I knew that nothing had changed from that perspective. I did not have a fever. I had a mild headache in the afternoon, and I wanted to take a short nap, but I'm also the mom of a toddler working full-time, so who knows where that came from, but that's certainly possible. I did not need to take any Tylenol or anything to alleviate a fever, although I had a plan to do that with my OB in the event that it happened. The risk of fever in pregnancy is really higher in the first trimester, which I'm not in, but if you walked into the hospital in your second trimester and you had a fever, anything greater than 100.5, you would be treated with Tylenol. So I had a plan to do that if I needed to. My second vaccine came at 24 weeks. I was on call. I operated the morning after the vaccine. Again, I had a sore arm, but I did not have any other side effects. I didn't have a headache. I didn't have any additional fatigue, no fevers, no nausea. It actually went really smoothly for me, which I'm very grateful for. But I would have been tolerant of all those other things for the ability to be protected. It is such a complex decision, and so I would tell them, don't feel guilty for questioning it. That's reasonable. You're no longer making decisions just for yourself. You're making decisions on behalf of another human, and I think that anybody who has children, whether they carried them or have raised them, know that your perspective changes when children are involved. And certainly when you're making decisions about your body that directly affect another person, it gets complex. So ask questions. You want to feel comfortable with whatever decision you make. Ask your physician. If you have friends who are pregnant that have received the vaccine or who work in healthcare and have extra knowledge, nurses, physician's assistants, doctors, respiratory therapy, anybody who's working in the healthcare field, ask them every question you can think of so that you can make an informed decision. Don't get your information necessarily from an untrusted source, a social media perpetuated meme. Go straight to the source, pull up the data, and if you can't understand it, find someone that you trust to help you interpret it so that you can make a decision for you and your family.